Let's give you the latest COVID-19 stats now. South Africa's cumulative COVID-19 cases have topped the 2 million mark as the country recorded 24,270 new infections in the last 24-hour cycle. 303 more people succumbed to the virus, bringing total fatalities to 61,332 to date. Gauteng accounts for the majority of the latest cases with 14,198, followed by the Western Cape with 2,606 cases. This comes as government tries to speed up the vaccination drive as the third wave continues to grip the country. Associate Professor and Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Mosa Moshabela, joins me now to give us more insights on the latest developments around the COVID-19 vaccines in the country. Good day to you, sir. Lovely to speak to you this morning. The numbers that we are talking about are really, really scary.
Good morning, Hugo, and to the viewers. Certainly, we have entered into the very grim stage of the third wave, not just in terms of the numbers. I mean, the numbers are reflecting the cases indeed, and they are quite high, and they seem unprecedented. But really, because it is also at this stage that we begin to see the deaths begin to rise as well, subsequent to the cases that have been growing in the past couple of weeks. And more and more we will be seeing a lot of increased deaths. And I think that it's going to be a lot of despair. And in many ways, I think that we need to recognize this as South Africans and be sensitive, be kind, and provide as much support and tolerance as possible.
Are you suggesting that we have not yet reached the peak?
So I think nationally we have not yet reached the peak, and also nationally we have not yet surpassed the peak of the second wave. But when you look at Gauteng, indeed, it is the major litmus test, the indicator of what is happening in the country, given the contribution it makes to the third wave currently. And we are seeing that if you look at Gauteng, there are 3 districts in Gauteng, Western in particular, but also Ekurhuleni and Tshwane, that seem to be stabilizing, and it looks like they are entering their peak. We are seeing still increase in cases in Sedibeng, but particularly in the city of Johannesburg. And for that reason, I think that there is definitely hope that Gauteng itself is entering a peak, provided that we continue to sustain the interventions that we've been working with. But as soon as Gauteng enters the peak, then a lot will then depend on what happens in other provinces. It is really our hope that the situation we are seeing in Gauteng will not be the same as in other provinces. However, Gauteng really, if it stabilizes, that is really going to give us a lot of hope. But as usual, Hugo, we know that the deaths tend to follow after the peak of cases themselves until we get to the peak of the deaths themselves.
Professor, how do we determine that we've actually reached the peak?
So if you look at the number of databases that we look at, the NICD, the South African COVID-19 Modeling Consortium, they have, this databases and that we can use to look at the numbers. So, for example, we can look at the number of increased cases from week to week to compare. We look at the 7-day moving average of cases. We look at the number of cases per 100,000. We also look at the percentage increase in terms of the cases. So there are all these indicators that we look at, and we can actually see currently that in those districts that I've mentioned for Gauteng, we are no longer seeing those increases. And the more sustained the stability of the new cases that we are seeing in terms of stability, it reassures us that we may be entering the peak. If we continue to see an increase in new cases, then we know that we have not really stabilized. And that's how we know that city of Johannesburg has not yet stabilized in terms of new cases. So those are the indicators, Hugo, that we look at to help us understand where we are at.
Professor, the new Delta variant is said to be more contagious. Will this possibly see a move into the dreaded wave number 4?
I think that given the situation in South Africa right now, in my own view, it's still premature to talk about the 4th wave. I think that what we are learning about the Delta wave, which is a lot currently, is that it is highly contagious, of course, and it has to a large extent driven the 3rd wave in South Africa. But my own view is that similar to what we saw in the 2nd wave, it was dominated by the Beta variant. And what we saw in the 1st wave, it was dominated by a different variant, the D614G. So the wild type, the original wild type virus. So it is really premature to talk about how the Delta variant could influence the 4th wave. I think what's really important for South Africa with regards to the 4th wave is to focus on expanding the rollout of vaccines as much as possible, because we are seeing in other countries like the UK and other places that where vaccines have been widely distributed, even if you have new cases, you don't see the same level of increase in hospitalization and death. And that, for me, I think would be really important as the goal of any subsequent waves that we might experience in South Africa. And a lot of it, in fact, all of it depends on our success in rolling out the vaccines, Hugo.
Now, there are many schools of thought that have suggested that the measures that were put in place, particularly when it comes to level 4 lockdown, came a little too late. What can we actually do outside of riding the 3rd wave, so to speak?
Yeah, Hugo, I think that, yes, indeed, there are many schools of thought, and I also share the same school of thought that says that the measures came a little too late. And in fact, we could have intervened a lot more at the time on the 30th of May when we were introducing level 2 restrictions. But we understand that it's a constant balancing act. And also, I think a lot of it depends on the risk perception in the population, the extent to which people perceive themselves at risk of infection. And sometimes, it's unfortunate that it takes this kind of crisis for people to understand that the risk is real. I personally, from a health promotion and prevention point of view, I wish that it didn't have to be like that. I do think that South Africa has done quite a bit, for example, in terms of the number of tests that we have done. We have expanded that. We haven't seen a lot of shortages there. And the positivity rate is sort of maintained. If we were not able to test at this level, it would be a problem. Having said that, I think that in the future, South Africa needs to make sure that testing is easily accessible so that individuals themselves can easily have access to testing. So that awareness, the more people are aware of their own risks, it will help for them to be able to take control of their well-being. A lot of it really, Hugo, depends on the individuals. Yes, there's a responsibility that the state needs to put measures in place to enable individuals to be able to take care of their health. But we know the risks, including the gatherings and others, that we have to observe. So I would say that really empowering South Africans to take care of their own health and well-being should be a goal of our South African healthcare approach.
Professor, you raised the issue of risk. There's also a certain amount of perceived personal risk where a number of individuals are reluctant to take the vaccine. I've had conversations with women that are saying that taking the vaccine would impact on their fertility. Your thoughts on that?
Yeah, indeed. There are many perceptions around the vaccines and the perceived risks and so forth. And, in a situation where we are refusing to offer vaccines to pregnant women and lactating mothers, I really wouldn't blame some women, to start to wonder why that might be the case. And they will fill in the gaps and come up with their own explanation, especially if the full explanations are not forthcoming. I do think, Hugo, that the issue of vaccination is one that we need to continue to talk about. We've also observed in Gauteng a report that says that nearly 10,000 teachers are not willing to take vaccines. And we know we should not force people to take vaccines. However, I think that we need to make sure that everyone is making a well-informed decision about it. You know, if people are going to make these decisions based on myths, based on misinformation and disinformation, that is not right. And so as long as individuals are making informed decisions, whether they take the vaccine or not, that will be important. The other thing that has become important, Hugo, is the need for people going forward to have options to, you know, look at their own individual risks. If someone has a tendency towards clots, they might prefer to take Pfizer. If they have a tendency towards allergies, they might prefer to take Johnson & Johnson and so forth. The options of the vaccines that become available are important for people to then make a choice in terms of their own preference. And I think we have not really addressed the issue.
Sorry, Prof, I'm glad you raised the issue of options. And news just in is that SAHPRA has approved the use of Sinovac's Coronavac vaccine for South Africans between the ages of 18 and 59. Your thoughts on this, finally?
Yeah, Hugo, the issue of Sinovac, I think it's an important step for SAHPRA, but it says very little about what the government of South Africa is going to decide about whether they're going to order Sinovac or not. Sinovac uses a whole virus of SARS-CoV-2 that has been inactivated. We've seen that it doesn't work well for people who are older. It requires people with a stronger immunity. And so we also have concerns about its efficacy, which is around 50%. But all of this information, I think we're going to have a detailed discussion around it in terms of Sinovac and make sure that the information is complete. The countries that are using Sinovac are experiencing resurgence, so we have to pay attention to all of that, the trial as well as the real-world use of Sinovac. But indeed, I think it's a positive step. It provides options in addition to Oxford AstraZeneca vaccine, Pfizer and Johnson & Johnson as vaccines are approved by SAHPRA. But there's still a lot to learn about Sinovac indeed.
Professor, thank you for your time. Associate Professor and Deputy Vice-Chancellor of Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela, and just highlighting that a lot more needs to be talked about, certainly around Sinovac.